Good evening. I'm Nima and this is Forum Daily for Tuesday, August 2nd. We begin tonight with a new report indicating an increase in sexual assault cases in the country. Stats Canada says there were more than 34,200 reports of sexual assault last year. This is an increase of 18% from 2020 and is the highest level since 1996. Sexual assaults account for a third of an overall 5% increase in reports of violent crime. Stats Can says homicides, criminal harassment, hate crimes, firearm offenses, and opioid offenses are also rising. This while nonviolent crime fell 3%. The agency points to an increase in the public discussion of issues around sexual violence. However, it says the number of sexual assaults reported to police is still likely to be a significant underestimate. Meanwhile, Foreign Affairs Minister Melanie Joly has announced new sanctions against 47 Russians. Most of them are military officers whose troops are accused of committing atrocities. This includes rape, torture, and murder against Ukrainian civilians. Canada is also adding 17 Russian companies and entities that have supported the invasion of Ukraine. More criticism comes on the heels of the Pope's historic apology tour of Canada. A member of the National Indian Residential School Circle of Survivors believes Pope Francis was freely expressing his own point of view when he told reporters what happened in the schools amounted to genocide. But Ken Young thinks the Pope should have said it before he left Canada and not on the flight home to the Vatican. He says that Pope Francis should have used the word when he was speaking with the First Nation survivors of Indian residential schools, as well as the Métis and Inuit. A Stats Can report released today indicates a rise in hate crimes, and one advocate is pointing to the internet as a platform for such ideologies. The executive director of the Canadian Race Relations Foundation says hatred online is so widespread that there is a risk it will become normalized and spread like wildfire. But Mohammed Hashim is warning against a mass scrapping of data. Instead, he's calling for checks and balances in upcoming federal legislation. This includes rules around which social media posts are sent to the police. Stats Canada released a report today saying there was a 27% increase in hate crimes last year. Turning to recent developments in the ongoing lawsuit against Hockey Canada, the lawyer for the woman who filed the lawsuit says his client recently passed a polygraph exam. The suit against the governing hockey body is over an alleged group sexual assault involving members of the 2018 World Junior team. The test result has been provided to police in London, Ontario, Hockey Canada, and NHL investigators. The woman alleges that 8 players sexually assaulted her following a gala event in the city. The case has also prompted an inquiry into Hockey Canada's actions by the International Ice Hockey Federation. On the East Coast, the Nova Scotia legislature is expected to pass a bill later today, stopping a pay raise for MLAs. The bill would rescind a recommended 12.6% pay raise for provincial politicians. The House of Assembly opened for an emergency session last Tuesday on this. It was to cancel the binding recommendations made last month by an independent review panel. Each member of the legislature makes an annual base salary of $89,234. On the other side of the country, parents in British Columbia can start booking appointments for COVID-19 vaccines for children between 6 months and 5 years old. Parents need to register their child with the province's Get Vaccinated system, which will generate a link and invite for a booking. Health Canada has approved a dose of the Moderna vaccine for children that is a quarter of the dosage for adults. Meanwhile, Correctional Service Canada says it will expand its needle exchange programs beyond the current 9 institutions. The announcement was made by a top official at the International AIDS Conference in Montreal. The agency reports 53 inmates were actively using the programs in mid-June. The conference wrapped up earlier today. Even amid delays and flight cancellations, Air Canada's revenue rocketed nearly 5 times higher from a year ago to $3.98 billion. The figures come from the company's latest quarter earnings, but the airline reported a second quarter loss of $386 million. This is due to what the CEO calls a very challenging 3 months. Air Canada says it regrets the disruptions its passengers have faced recently, but it says they were primarily driven by issues with airport security screening, border customs processing, and air traffic control, among other issues. Forum Daily will be right back after the break with a look at paramedics and healthcare staffing shortages. We're going to be speaking with Mr. Deines, the president of the Canadian Paramedic Association. He's going to help us unpack the issues and difficulties that paramedics around the country are facing. Before the start of the long weekend, groups representing paramedics warned that people who call for an ambulance in Ontario may have to wait longer for one to arrive. This is primarily due to healthcare staffing shortages and temporary emergency room closures, which were predicted to slow down the response times for emergency services. Ontario's health minister says the system is facing pressures due to the challenge of maintaining the required staffing levels. And this problem is not limited to Ontario, as staffing shortages are impacting healthcare systems across the country. Well, with us now to discuss the impact of these staffing shortages on paramedics in particular is Mr. Deines, president of the Paramedic Association of Canada. Sir, welcome to Forum Daily.
Good afternoon.
So let's start with how this long weekend was for paramedics amid these staffing shortages.
Yeah, thank you. So the long weekend traditionally is a very busy time for paramedics. We see lots of people going to enjoy the outdoors and recreating, which in turn creates more ambulance calls and requests for service. So normally it's a busy time in the summer anyway. But you couple that with the recent shortages and closures with medical facilities around the country, places an enormous strain on paramedic systems from coast to coast to coast.
And in addition to this, we know offloading delays are also responsible for tying up paramedics. So what exactly are offload delays and how long could these delays be?
Yeah, so an offload delay happens when a paramedic crew arrives at a medical facility, traditionally an emergency department, and the department is so overworked and with so many patients that they're unable to accept the patient from the paramedics, which means that paramedics have to stay with the patient, traditionally either in a hallway waiting for to be triaged and placed into a bed, or in some extreme cases that we're seeing now, we refer to ramping, where the patients remain inside the ambulance on the front ramp of the emergency department waiting to be triaged and placed.
And can these delays be seen across the country, or are certain regions more affected than others?
Definitely, it's a problem we're seeing across the country, as you can imagine, in larger urban and metropolitan centers around the country that are experiencing higher than normal call volumes, coupled with shortage in staff in both the paramedic system and the healthcare system globally. It creates this vicious cycle where there's just not enough staff to take care of the patients inside the facilities, and there's not enough paramedics to respond to calls for assistance.
So how are Canadian paramedics feeling amid these staffing shortages, offload delays, and the pressure from the job itself?
Yeah, as you can imagine, the last 2.5, 3 years have been a very challenging time for paramedics and paramedic dispatchers around the country. With obviously the COVID pandemic has placed an enormous challenge on the work that we do. In some jurisdictions in Canada, we've coupled that with, for example, in British Columbia, the opioid crisis, as well as the recent climate emergencies are all compounding on workload, stress, and burnout on paramedics. And then you couple this now with a staffing shortage, both in paramedic services as well as healthcare facilities, and it's really taking a toll on paramedics from around the country for sure.
And bringing this back to our viewers, how are all of these factors, these compounding factors, as you say, impacting patients and services overall?
Yeah, well, as you can imagine, if the paramedic crew is waiting at a hospital on an offload delay or is unable to staff an ambulance because of paramedic shortages, then that's one less ambulance that's available in a system to respond to people in their time of need. And prior to COVID, many systems in Canada are operating at or over 100% capacity to begin with. So anytime we add an additional strain onto the system, that translates directly into delays in responses for paramedics.
All right. Well, meanwhile, we saw these emergency department closures or reduced hours during the long weekend. Could you see this becoming the norm due to staffing delays?
Certainly, it's become more and more common in our experience around the country. with delays to access healthcare facilities, or in some cases, paramedic crews having to bypass a hospital to go to the next closest community because they are shut down. And again, that just adds to that pressure on the system, where if you take a paramedic crew from one geographic area that has to go now to another one in order to transport a patient to another facility, that's one less ambulance that's available to respond in that community. So it's definitely an ongoing issue. And without some immediate intervention, the problem is only going to get worse.
An issue that definitely needs to be solved by our officials. We'll definitely have to keep an eye on this situation. But Mr. Deines, thank you again for joining us today on Forum Daily.
Thank you so much.
Stay with us. When we come back from commercial break, we'll be taking a look at the International AIDS Conference, which wrapped up in Montreal this afternoon. We'll be speaking with Mr. Gary Lacasse, the president of the Canadian AIDS Society, to discuss the announcements made during the conference, as well as the rise of people living with HIV in Canada. Stay with us. We'll be right back after a short break. The International AIDS Conference wrapped up today at Montreal's downtown convention center. More than 9,000 delegates from around the world were scheduled to attend the conference in person, with another 2,000 registered to participate remotely. Yesterday, Federal Health Minister Jean-Yves Duclos announced the government is investing nearly $18 million to expand access to HIV testing in Canada. A coalition of advocate groups says that Ottawa needs to do even more. They note the number of people living with HIV in Canada has risen by 25% since 2008. Well, joining us now to talk more on this is Mr. Gary Lacasse, Executive Director of the Canadian AIDS Society. Sir, welcome back to Forum Daily.
Thank you. How are you doing?
I'm doing great, sir, and we really appreciate you joining us. We know you're just coming back from the conference today. So what was this year's theme at the conference? What were the main points discussed today?
Well, the theme was re-engage and follow the science. So it was really a privileged place to re-engage with our peers across the ocean and around the world. And it was really interesting to re-engage our partnerships and also our knowledge base of what's happening around the world and cross-pollinating our way forward.
And we mentioned Canada has seen a 25% increase in people living with HIV since 2008. So where does Canada stand in terms of people with HIV compared to other countries?
Well, we're the country in the G7 that's lagging the most concerning HIV. So that's where we're starting from. And that's where the minister did not acknowledge with his announcement yesterday where we are. So we find it very disingenuous from the public health agency officials that are here, all the way up to the Minister of Health, and even by no ministers or the Prime Minister being present at the opening ceremonies, which they were contractually obligated to do, was very unfortunate, because we've been trying to explain that to many delegates, and it's just egg on our face, and that whole issue resides on the shoulders of Justin Trudeau.
And on that note of the Minister of Health, we mentioned the announcement on expanding access to HIV testing in Canada. So just how accessible is HIV testing in Canada, especially for those most affected?
It's a patchwork quilt across Canada because we're a federation. So when it comes to HIV testing, we have to have many technologies that are offered so that people can reduce the barriers to testing. It's not just self-testing. And if you'll notice, in the investment, half of the money is going to the national laboratory in Winnipeg, which is staying internally in the government. So it's not reaching our priority populations that way at all. So we're asking for better technologies, not just self-testing, but wraparound care in testing.
And it's clear that advocates are calling for a lot more action from our officials. So what other steps does Canada need to take in order to help this growing number of people affected by HIV?
They need to step up their game. They need to invest more to ensure that the rising cases are reversed and we get down to where we were prior to 2016, where we were seeing decreases year after year. So that means investing in care and support to people living with HIV. It means having adequate access to medication and equity across Canada, which we don't have because we do not have a national pharmacare program, which the Liberals promised in 2015, which they have not delivered yet. So we need to step up our game, and we have to have more equity and more equitable access to many different things. But we do have some things to really celebrate with U equals U, like undetectable equals untransmittable, which is a huge tool in our toolbox, which is somebody who is using their medications and continuously and reach undetectable cannot transmit HIV anymore. So, that it's breakthroughs like that we have to build upon to reduce stigma to people living with HIV. And we also have to decriminalize HIV disclosure, which hasn't been done, which has been promised since 2015 from the same government.
It's clear a lot of work needs to be done. All right, Mr. Lacasse, we've got a quick 30 seconds left here, but what are you watching for next coming off the heels of the conference?
Well, what we're watching for next is to re-engage with Minister Duclos, as we've had some privileged space to meet with him during the last couple of days, and to engage in really meaningful conversations and also address the issues that have been holding them back from doing it. Why are they not investing in HIV in Canada? And I think that also is on the shoulders of the public health officials to respond to that.
All right, Mr. Lacasse, thank you again for your time today. U.S. House Speaker Nancy Pelosi has arrived in Taiwan for a visit that has escalated tensions with China. China claims Taiwan as part of its territory to be annexed by force if necessary. It has announced a series of military operations and drills following U.S. House Speaker Nancy Pelosi's arrival in Taiwan. The People's Liberation Army says the maneuvers will start tonight in the waters and skies near Taiwan, and they will include the firing of long-range ammunition in the Taiwan Strait. Meanwhile, the timing of the U.S. drone strike that killed al-Qaeda leader Ayman al-Zawahiri couldn't come at a worse time politically for the Taliban. It has faced international condemnation for refusing to reopen schools for girls above the 6th grade, as well as sharp criticism for human rights abuses. The U.S. has seized upon Mr. al-Zawahiri's killing as a sign that the Taliban violated the Doha Agreement, under which they would not allow Afghan territory to be used by terrorists for threatening the security of other countries. Moving to a meeting of Southeast Asian foreign ministers that are gathering in the Cambodian capital to address the violence in Myanmar and other issues. They will be joined by top diplomats from the United States, China, Russia, and other world powers. This comes amid tensions over the invasion of Ukraine and concerns over Beijing's growing ambitions in the region. Topics of concern include Russia's invasion of Ukraine and the impact it had on global food and energy prices, as well as escalating friction between the U.S. and China. All right, in Iraq, protesters were told to leave the parliament building after they stormed the capital on Saturday to prevent the voting in of a new government. Followers of a Shiite cleric camped out inside the Iraqi parliament building for a 4th straight day. They were instructed to leave the building but maintain their protest outside. A representative of cleric Muqtada al-Sadr told the hundreds of loyalists to move within 72 hours. The cleric and his party were winners in the October parliamentary elections, but were unable to muster a majority of support to form a government. His followers stormed the parliament Saturday at his command to prevent the Iran-backed Coordination Framework Alliance from voting in a new government. All right, turning to the Congo now, where the government is reassessing the presence of United Nations peacekeepers. This comes after protests against the force in the country's east have killed at least 36 people. Demonstrations escalated after UN peacekeepers opened fire on civilians, killing 3 at an eastern border post with Uganda. Congo's government spokesman said in a statement on Tuesday that more people have died in 4 other eastern towns. He said after government consultations, populations in those areas have clearly requested to have the UN peacekeepers leave Congo. British prosecutors have charged a man with intending to injure or alarm Queen Elizabeth II after he was arrested at Windsor Castle on Christmas Day. 20-year-old Jaswant Singh Chahal has been charged under the Treason Act. This was after allegedly being caught with a crossbow on the palace grounds. Mr. Chahal from Southampton has been charged with discharging or aiming firearms or throwing or using any offensive matter or weapon with intent to injure or alarm Her Majesty. That amounts to an offense under Section 2 of the Treason Act of 1842. Back in the U.S., Kentucky Governor Andy Beshear says the rain that unleashed massive floods is tapering off, but people are now facing a new threat. Temperatures are expected to soar in the region. This is where crews are still trying to reach people cut off by floods and mudslides. The death toll is at 37, but Mr. Beshear says hundreds remain unaccounted for. This is a number that should drop once cell phone service is restored and people can inform each other that they're alive. British Airways is suspending ticket sales for short-haul flights for domestic and European services out of London's Heathrow Airport for about a week. It is taking action after Heathrow capped daily departing passenger numbers. This was to help ease travel disruptions caused by rising demand and staff shortages. Canadian soccer star Alphonso Davies says he will donate his World Cup earnings to charity. The 21-year-old Bayern Munich fullback was born in a Ghanaian refugee camp after his parents fled the civil war in Liberia. The family came to Canada when Alphonso Davies was 5 years old and eventually settled in Edmonton. He says donating the money to charity is his way of giving back to Canada. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow our social media handles on Facebook, TikTok, Instagram, and Twitter. You can also watch all of our commentary, programming, and interviews on the News Forum YouTube channel. All right, thanks for joining us today on Forum Daily News, and we'll see you next time. Take care, Canada.